Greetings of the day, everyone. Hi, I am Desney Remika Fernandez, here to present an e-poster about cross-sectional survey on assessment of awareness, attitude, risk perception, and preventive behavior of Indian public towards COVID-19 pandemic. Introduction. For about 1.5 years, we have been facing this pandemic due to COVID-19, which is an infectious disease caused by severe acute respiratory syndrome coronavirus 2, which was started in Wuhan, central China, and was globally spread. This is known to cause severe lower respiratory tract infection and can be transmitted via humans through a respiratory droplet. Adhering to the guidelines given by the healthcare authorities is the only way to prevent the transmission. Awareness, attitude, preventive behavior, risk perception of the general public towards the COVID-19 pandemic influences the adherence. Hence, the study was designed to assess the awareness, attitude, preventive behavior, and risk perception of the public towards the COVID-19 pandemic and adherence to the national guidelines to prevent the transmission of the novel coronavirus. Methodology. This study was designed to be conducted as a cross-sectional survey across India, and hence an online survey was conducted with the help of self-structured questions developed via Google Forms considering several issues related to COVID-19 pandemic from Indian perspective and was accessible via emails and social networking sites. Results. The questionnaire was circulated to 750 individuals and 537 of them have participated. 39.1% of the participants retain strong awareness about the prevention. 426 respondents were not suspected for COVID-19. 5 were tested but found negative. 1 was tested and found positive, and 105 responded to not reveal their status. Here is a bar chart of response to avoiding COVID-19 infection. About 300 of the participants found easy to escape the infection. Statistics of preventive behavior followed by the participants is mentioned below, and nearly 500 plus have actively followed the preventive behaviors like washing hands, sanitizing, face mask, etc. When the respondents were asked to rate the extent to which they adhere to the national and local guidelines on preventive measures to decrease the spread of COVID-19 on a linear scale of 1 to 5, where 1 very low adherence, 5 very high adherence, 411 rated 5, 102 rated 4, 19 rated 3, 3 and 1 rated 2, 1 respectively. When asked to rate how easy it was not seeing their family, friends, etc., on the scale of 1 to 5, where 1 is impossible and 5 is very easy, 113 responded 5, 123 responded 4, 182 responded 3, 55 and 64 responded 1 and 2 respectively. Here is a bar chart about the attitude towards the preventive measures to decrease the spread of COVID-19. 200 plus of the participants had very excellent behavior. Discussion. COVID-19 has been a concern to you, me, everyone, because it has caused considerable loss of lives, significant spread of deterioration of physical, mental, social, and financial well-being of individual. Adherence of each individual citizen to the guidelines issued by the health authorities is very crucial in preventing the spread of COVID-19. Majority of the study participants were unaware about the people who were tested positive or home quarantine or staying in their vicinity. Lack of awareness can lead to inadequate caution. Here is a bar graph which represents the measures used by the participants. So about 96.5% have been following the primary preventive measures such as wearing face mask, hand sanitizing, etc. And about 73.4% have been using other precautionary measures such as taking supplements, staying away from crowds, etc. Conclusion. Adherence to public health guideline is directly proportional to awareness, attitude, and preventive behavior of people in any given locality or region. Herein, we report high degree of adherence and high awareness of participants to the guidelines to prevent the transmission of COVID-19. However, the attitude of participants towards COVID-19 vaccination was found to be relatively low. Hence, people should be sensitized about the need of COVID vaccine. High awareness and adherence was reported in our study because of the major proportion of study participants were healthcare professionals. In future studies involving participants from non-medical professions are required to determine the awareness attitude of general public and understand how they influence the adherence to the public health guidelines to prevent the transmission of coronavirus. Thank you.